Hello everybody, my name is Larry and this is my channel on living with stage 4 metastatic prostate cancer. Today I'm just going to talk a bit about the checkup I had with my primary care physician, Dr. Fathy. Take this opportunity to ask you, if you like this channel, please subscribe, and if you like this video, please hit the thumbs up. Regular checkup, I've been going in about every 4 months to see Dr. Fathy, and it generally starts with the nurse going over my medications. We verify each med that I'm taking or not taking anymore. In this case, I made sure they know I'm not taking Erlita. I'm on a vacation for that. And that I'm still taking Lupron shots. I just had one last week, 2 days before my visit with Dr. Fathy. When the doctor came in the room, we went over my most recent blood test results, which were from March, but he went over them with me in detail, which is something my hematology oncologist doesn't really go over them in detail with me. Basically, the tests I get are checking, well, a lot of things, but they're really concerned with my white blood cell count, red blood cell count. They're trying to make sure, in the case of the white blood cells, that my immune system is working correctly, which, since cancer is an immune system very sensitive disease, they take a good look at that. So all my blood tests are good, basically. That's the good news. And then we got into a conversation about my forthcoming trip, which I'll be going overseas for 2 weeks. So Dr. Fathy went over all my most recent vaccination situation with me, my COVID vaccinations, tetanus, shingles, pneumonia, and all of those are up to date. So he said that's all good. And he also told me he had just been in Ireland recently, and that England, Ireland, Scotland don't have any special vaccination requirements for people coming in from the United States. So that's good. But we also talked about, I need to notify my hematology oncology department that I'll be overseas. And obviously I need to take enough for my prescriptions to carry me through those 2 weeks over there. And he said it's perfectly fine to call him in case something happens with the medications, that I don't have enough or whatever, and he could somehow take care of that or help me out anyway. So all things are good. My latest PSA levels from March are less than 0.02, which is the indicator I have right now. Well, I also talked with Dr. Fathy a little bit about the last time I had an MRI test or any sort of a test for my metastatic cancer, which was in my lung. He suggested I talk to my hematology oncologist, which I will see again in September. I believe it's September 12th. So I'll bring that up then at that time. And that's where I stand today. So if you have stage 4 metastatic prostate cancer, or someone you love has stage 4 metastatic prostate cancer, please stay in the game. Do not get discouraged, and just enjoy life. Enjoy every moment you have. It's a miraculous thing. So peace, and I'll talk to you later. Bye-bye.